effectively combine data across IPUMS DHS, IPUMS PMA, and IPUMS Mix. So let's go over some logistics of how this webinar is going to work. The webinar is being recorded, and we will post it along with your questions and our answers to them soon after this on the IPUMS www.ipums.org support page, along with other webinars. Closed captions are being auto-generated, which you can turn on and off clicking the CC button in the Zoom controls. We hope that you will be sending us questions. If there is an issue with the Zoom, like I can't hear anything, or your picture went away, or something like that, then send it via chat. But if you have substantive questions about the content or the future of these projects, anything like that, as we go along, feel free to enter questions in Q&A. Our presentation will last 40 to 45 minutes, and then we will turn to your questions. Okay, so let's first tackle a question which I know is on many people's minds, uncertainty about DHS data. As many of you have heard, the Trump administration has ended funding to the DHS program, along with many other cuts to USAID. I want to first reassure you that IPUMS is continuing to offer access to harmonized DHS data through IPUMS DHS. We're continuing to work on harmonizing data from more surveys, and we are not funded by USAID, so we are not affected by that cut. ICF, the organization, a larger organization that housed the DHS program, is continuing to keep up the servers and the web page for the original DHS data. So if you are already approved to download DHS data, you can continue to do that through IPUMS DHS or through the original data files. The issue is basically, at this point, there is not a mechanism to expand access to the data if you're an approved user, or to sign up for access to the data if you have not gotten access to DHS data in the past. There is a lot of discussion in the statistical community and among international organizations about the importance of DHS data and the importance of maintaining access to those data. And we are part of those discussions. We are cautiously optimistic that access will be opened up and these very precious resources will continue to be available to the broader research community generally. Fortunately, DHS was not the only game in town in terms of collecting global health data. And if you have only used DHS data in the past, now is a good time to think about going to other sources, especially IPUMS Mix and Mix data collected through UNICEF. And this webinar will help you learn how to correctly, with minimal work and errors, combine DHS data with other sources like IPUMS Mix and IPUMS PMA. Okay, I'm going to now turn things over to my colleague, Devin Christensen, who is the IPUMS PMA project manager and the research manager for IPUMS Global Health. Thanks, Devin.
Thank you so much, Miriam. So as my colleague Miriam said, it's IPUMS' mission to disseminate data. And we are dedicated to providing integrated data for free to the world's researchers. We provide access to harmonized census and survey data from around the world from as early as 1970 to the present. We also systematically document the data at the variable level to save researchers time and ensure comparability of data over time and place. And like we always like to repeat to everyone, the access to data is always free because we are grant funded. And we're also based at the University of Minnesota, Twin Cities. Among the 13 individual data collections at IPUMS, there are 3 projects under an umbrella that we refer to as IPUMS Global Health. So these include the Demographic and Health Surveys, UNICEF's Multiple Indicator Cluster Survey, and Performance Monitoring for Action. Each of these surveys have unique characteristics, but there's enough overlapping content to use 2 or 3 of these projects for the same indicator calculation. And while each project contains nationally representative household surveys in predominantly low and middle income countries with a focus on women's and children's health and well-being. So each of these projects or data collections vary in scope. They do have quite a bit of overlapping coverage in recent years and also in geographic scope. For more detail on each project, since we have a limited amount of time this morning, we invite you to visit each individual IPUMS website. So that would be IPUMS DHS, IPUMS Mix, IPUMS PMA. And each of these data collections have recorded webinars introducing each of these projects in detail, a lot of documentation and user notes, user guides. We will also be referring to each of these data collections as projects. So you may also hear me say survey types, but I am going to try to be specific and say data collections. And I mean, IPUMS DHS is a data collection, IPUMS Mix is a data collection, and so on. So, just to highlight what I mean by an overlap in geographic coverage. For the 2 larger of the projects, DHS and Mix, this presents opportunities for extending analyses over time in the same countries. You can see there's quite a bit of overlap in both projects in Africa and South Asia. So IPUMS DHS staff are currently working on harmonizing data from Latin America, the Caribbean, Eastern Europe, and Central and East Asia. Previous work and previous funding had focused intensively on harmonizing African and South Asian data, but we do have plans to expand and create even more opportunities for interoperable data analysis. Another thing to keep in mind is that IPUMS Global Health projects and data collections contain different units of analysis or populations based on the focus of the surveys. So as you can see, there's quite a variety of populations or units of analysis here, a variety across these data collections. But we are going to be focusing for this webinar on the household characteristics and women units of analysis. So what we've heard many users ask is, with so many similarities across these data collections, can we pool data across projects? Our answer to that is yes. However, there are some limitations. And the purpose of this webinar is to walk you through what we see as key limitations and considerations that we want our users to keep in mind as they pursue a research project. So as you begin a new research project that aims to utilize the data from multiple data collections or just multiple samples, even within one data collection, there's some considerations you need to address. While this is not necessarily an exhaustive list. We believe that these are the core considerations you should keep in mind as you move forward with a project. So in the black text on the left are a list of issues that we're going to go one by one and cover today. And then the purple text on the right, that notes kind of the framework that we'll be discussing for each of these considerations. So we will go over how it's important to consider comparability issues within a data collection if you're pooling multiple samples. And then also how it becomes even more important to make these similar considerations when combining data across data collections. We will be using a research example to demonstrate each of these concepts. And finally, we will cover ways that IPUMS Global Health is providing additional support or solutions. The To illustrate each consideration, the example analysis we've proposed is so a researcher may wonder, what is the relationship between age, family planning use, and access to mobile phones? And further, does this association differ across time and place? And with that, I'm going to pass it to my colleague, Dr. Anna Bulgren. She is the project manager for IPUMS Mix.
Hello, everyone. So as Devin mentioned, there are many topics in common across these surveys, and there are also possible differences within each data collection project. Countries that participate in each of these data collections have unique priorities, and the data collections, DHS, Mix, or PMA, have responded to these priorities, and this results in changes to the surveys across time and between countries, even within a particular project. At IPUMS, what we specialize in is harmonizing these differences between countries and across time. From each of the IPUMS project websites, you can browse for specific variables on different topics. For example, this is a screenshot from the IPUMS DHS website that shows the availability of family planning variables among DHS samples. And you can see that some of the samples have different variables, but they aren't available in all samples. So when thinking about interoperability, it's important for researchers to first explore each of the project websites to learn about what variables and topics are available, because each data collection has unique focuses, funding priorities, and therefore data and variable availability. Some projects are better suited for different broad topics. For example, UNICEF really strongly emphasizes children and children's well-being, and this means that there are many detailed variables on children's health. PMA is well positioned to study detailed questions on family planning because the emphasis of PMA was to align with the Family Planning 2020 goals. Now, this is not to say that these projects are the only projects that have information on these topics. There are, for example, DHS also has children's health information quite widely. DHS also has detailed information on family planning providers. There are certain research areas and data that are more common in a particular data collection or more detailed in a particular data collection. But it is still important to explore all of the websites in order to get a big picture of what might be available for a given topic. In these tables, I've summarized the different high-level topic areas for each project relating to our example research question about media access and family planning. Here you can see, particularly in the family planning column, that PMA has a lot of different topics and details about different aspects of family planning, whereas Mix has a very limited range of information on family planning. I've highlighted in bold a topic that all three projects have: current use of family planning. So this is something that a researcher could work with all three data projects to look at questions related to current family planning use. One way that IPUMS is supporting topic and variable discovery and thinking about how to find out which projects have which variables is through the IPUMS Discovery tool. And this is a search feature that allows researchers to search for keywords and see what variables are available in different projects. Here's an example where I've searched herd contraceptives, and the Discovery tool has shown several variables, both from mix and PMA, but this is only a small subset of the results, and further down, you would also see DHS samples. This tool can be very helpful because it can help identify different variables from different projects, all with one search feature. The next consideration researchers should take into account is what is the population for the particular research question or topic that you're interested in. As Devin mentioned earlier, populations sometimes are referred to units of analysis or even data sets because that is typically what data availability are referring to. So as you've already seen, each data project has different units of analysis or available data files, but there are data files that are comparable across the projects, particularly the households and the women that we'll be highlighting today. When you're thinking about variable or topic availability, typically variables related to specific topics can be found on the unit of analysis for which that variable refers to. So, as one might expect, information on women's family planning is found on the woman unit of analysis or in the woman data file in all three of these projects. Now, there are some exceptions because of differences in survey design or data collection changes over time at a data collection level. One example is if the topic that you're interested in is child discipline. Sometimes this is found on the household member file in DHS. Sometime in IPUMS mix, it can be found on the children 0 to 4 unit of analysis, but also in some samples, it can be found on the household unit of analysis. And this is due to the way that DHS collects data or mix collects data over time. Now, this can be very confusing, and we would highly recommend using the IPUMS Discovery search feature so that you can explore availability across projects, but also across units of analysis. And this will help more discovery about what would be available. Another important aspect regarding population is the underlying survey design within a data collection. And this can lead to differences in the sample design. For example, some countries in DHS only survey married women, and others include all women of childbearing age. We document these universe differences in the universe section of the website specific to each particular variable, and also at the high level sample design within a given data collection. There are also considerations about the survey design between projects. One example is DHS has information on children 0 to 4 of the interviewed women in the household, where mix has information on all children 0 to 4 within a household. So this means that fundamental to the way data were collected in each of these two data collection projects, DHS and mix, there are differences in the underlying population, and this may be very important to your research question, or at least is worth careful thought and consideration on how you would want to address these population level differences when working on your analysis or creating your indicators. Now I'm going to pass this back to Devin to talk through some more of the considerations.
Thanks, Anna. So now we're going to apply what Anna just spoke about in terms of sample and survey design differences and how that applies to our research question. Across samples that we would like to use for our research example, there were differences in the sample design subpopulation, both within and across data collections. Like the screenshot shown just a few slides ago, there were differences in whether it was an ever married women sample or all women sample, and there was also differences in the age range. So in order to make sure that we are studying the same subpopulation over time, we've decided to restrict our analysis to keep only ever married women, but then we could restrict the subsample to ever married women. But there are also contextual factors that we want to consider if we are doing a cross-country analysis about current family planning use. So a contextual factor at play may be the societal acceptability of extramarital sex, which may differ across countries. So what we eventually decided to do for this concrete research example is that we would like to restrict the subpopulation to currently married or in union women of age 15 to 49. And so refining our subpopulation very specifically lets us track differences in behavior rather than differences in population composition, either across time or across place. In other words, we want to make sure that we're using common denominators across sample, regardless of which database the sample comes from. And then there's a further difference that we want to consider, not just at the sample level, but also at the variable specific subpopulation as well. And so we would refer to this as a universe difference. So the variable indicating whether the woman was using a family planning method has different logical skip patterns across both within a data collection across samples, but also across data collections. So the general range is that the logical step sometimes differs by pregnancy status, partnered status, or whether she had ever used family planning before. And when considering each of the samples that we were considering including in our analysis and the logical skip pattern or variable universe for family planning, current family planning use, we've decided to keep to further refine the subpopulation to keep only non-pregnant and currently partnered women. And there was one example of some PMA samples where they restricted the universe to women who had ever used family planning. So the solution here, there's two options that we considered. We could either recode recode those cases of women who said they had never used family planning, because if she'd never used family planning before, she could not be a current user. So we keeping in mind the base universe of that of the ever use family planning variable, that might be appropriate to keep those women in our analysis as not current users, but we could also be very conservative and drop those samples in the face of that comparability issue. But in either case, both sample design and universe differences are reflected on that universe tab at the variable level. So you will have all that information in one place on our IPUMS websites. So another issue to keep in mind is geography. So generally speaking, which countries are included in each data collection? And are there consistent geographic boundaries if you're doing a sub-national analysis? So for one example, with any research projects you do, even just within one data collection, you need to consider the country availability within a data collection. And also, so for some samples in PMA, but also in IPUMS mix. Some samples are sub-national only and not nationally representative. For PMA, there's in Niger, some samples are nationally representative and some are subnational. So you need to keep in mind what the survey coverage is within a project. And so, and then considering across projects, across data collection. So you've seen this map already, but you need to consider the country availability across projects. And either way, whether you're doing within or across data collection analysis, you need to make sure that you're using the same boundaries if you are doing subnational analysis. So one approach here is spatial harmonization. So if there is some deviation across samples, either within or across data collections, there could be political boundary changes that just naturally happen over time, or there could be a change in the level of detail that is released in the public use data, just in for how it's collected, or like how a woman is assigned as like what level of geographic detail there is. And so, but you can also have to keep in mind that some surveys conducted at national, subnational levels to begin with. And so if you're doing a subnational analysis, the boundaries of identified regions need to match across samples so that you're comparing the same geographic footprint. Because if you are including additional areas as they change over time, you're not studying the same subpopulation and you could be introducing spurious results. So our geography team at IPUMS has done a lot of work to spatially harmonize subnational regions across time within each IPUMS database. So this includes consistent boundaries, boundary files, and also integrated geography variables that reflect consistent boundaries. So I'll give you an example of some change over time within a data collection. So IPUMS, so PMA collected data in Uganda from 2014 through 2023. And starting in the 2020 Uganda sample, they began using different administrative boundaries in Uganda. So that's reflected in the geography variables for samples 2020 onward. So we have reflected this in shapefiles, and we've also created like backwards compatible geography variables to make sure that if you are trying to do subnational analysis over time in Uganda, that you make sure to use the spatially harmonized version. And then when we're talking about across data collections, we can confirm that Nigeria samples in PMA and mix are using the same administrative boundaries for zones. So we could conduct a subnational analysis using data from PMA and mix as far as geography is concerned. But one example that the coverage differs is Côte d'Ivoire. So PMA as a data collection is focused on nationally representative indicators primarily. So they do not always collect data in every subnational administrative unit for every country. We could not conduct a comparable subnational analysis in Côte d'Ivoire for every subnational area between PMA and mix. And as this geographic harmonization applies to our research example, we chose 9 sub-Saharan African countries that were included in all 3 projects or had a long time series that had all nationally representative samples and otherwise met other comparability tests. So for our research example, we're working at national levels, so subnational boundary differences aren't relevant in this case. And so for spatial harmonization within data collections, IPUMS has constructed harmonized geographic variables over time. For across data collections, we currently have a crosswalk between IPUMS DHS and the IPUMS International Census Project. We have plans in the near future to make crosswalk variables between IPUMS DHS and IPUMS Mix. Each project has a geography user guide page with PDFs and shape files for you to check for consistent boundaries as well. And so for the next consideration to keep in mind is changes in survey and questionnaires can pose some comparability issues when pooling different samples either within or across data collections. However, within all of our databases, each variable has a detailed online documentation about how the question was asked for each sample, and you'll find that on the questionnaire text tab over to the right. There is also a comparability section detailing within project or within data collection comparability issues. The body of the comparability text covers broad issues. For example, the text might note how question wording subtly changes between phases for the DHS or between rounds for mix. And then the comparability text also covers specific comparability issues over time, country by country within a database, if applicable. So when you are working with more than one sample, you'll need to check this online documentation while planning your analysis. And we have an example here. So this checking helps you make adjustments, either dropping some cases to analyze similar populations or evaluate whether differences for the question wording, for example, matter to your analysis. And so you need to be doing this work when you're working with multiple samples within or across. And this is an example from PMA to illustrate. That's relevant to our mobile phones and family planning example. So in the first round of data collection for PMA, the question about current family planning use was phrased as, are you currently doing something or using any method to delay or avoid getting pregnant? Versus later rounds added the or your partner language. So it's now, are you or your partner currently doing something or using any method to delay or avoid getting pregnant? So this is documented in our comparability tab, as was shown in the screenshot on the previous slide. So in this example, we might consider dropping the earliest round if we believe that enough women would have answered differently between the two wordings of the question to affect our analysis. So this could be the case if male sterilization is a common family planning strategy in a certain context, and it would lead the woman to answer differently between, are you currently doing something, or are you or your partner currently doing something? So other research projects might want to conduct sensitivity analyses when comparing the two types of question wording. With that, I am going to pass it back to Anna.
Thanks, Devin. As was just shown, there's a lot of documentation on the IPUMS websites that have all sorts of information that can answer a lot of different questions about the variables that you might want to use in an analysis. In this next section, I'm going to highlight coding structure and variable name issues that might come into consideration when thinking about interoperable research. In this screenshot, you see the variable from the IPUMS DHS project called FP-METH-NOW, Family Planning Method Now, or the current method of family planning, as it is designed and developed within the IPUMS DHS project. These codes along the side here are the codes that you would see if you were to add this variable to an extract and then load this data into a statistical software like Stata or SPSS. And we've organized and created these codes for our integrated variable FP-METH-NOW based on the categorizations that were available in the DHS surveys and the way that DHS had coded these variables originally. We've maintained different structures, such as keeping a distinction between modern methods and traditional methods. And we've also retained a lot of the details about different types of methods using composite coding. So you can see that this coding structure is representative of multiple different samples and within the IPUMS DHS. Each of the IPUMS Global Health projects was developed independently based on the data coming from DHS, mix, or PMA, and this has resulted in variables and coding structures to be unique to each IPUMS project in ways that reflect the data collection and availability. So therefore, even if variables are identical or incredibly similar in concept across the projects, they likely have different variable names and very likely have different coding structures. So for example, these variables on this slide, FP meth now for DHS, CP now for mix, and FP cur use for IPUMS PMA, all represent an identical question that was asked to women, are you currently using family planning? As you can see from DHS and from the previous slide, the DHS variable is structured in a way that lists out the different methods. However, for PMA and mix, this variable is just a simple binary that reflects whether or not a woman is currently using family planning. So in order to take these three variables from three unique projects, you would want to, and to combine them into a way that's interoperable across these three projects, you would fundamentally want to rename these variables so that they shared a common name when you merge these files together. And you'd also want to take into consideration the difference in the coding structure and do some recodes so that the codes were in common across these projects. And you would want to refer back to the documentation and look at all of the different types of comparability, questionnaire wording, and descriptions available on the website. Now, this renaming and recoding can be cumbersome and a little bit difficult, but it is vital to do prior to merging files, particularly files across projects. What we have started to do at IPUMS is to do this renaming and recoding for you by creating new global health variables. These variables are denoted by an _GH for global health, and they are found for all projects for which they're available for. They are identically named and identically coded across the projects, and we've taken extra steps to minimize comparability issues and limit universe differences as much as possible based on the information from each of the projects independently. So here in the purple column, you can see the new variable FP now _GH represents a common name and a common coding structure for those three different variables, FP meth now, CP now, and FP cur use from the individual projects. If you were to make a data extract from any of the projects, you could add this variable FP now _GH to your extract. And then if you were to merge extracts from multiple projects together, this would have an identical name and an identical coding structure. So you wouldn't have to do all of that renaming and recoding work. We have started this initiative by looking first at women's variables, highlighting things that are in common across the global health projects, thinking specifically about demographics, fertility and family planning, domestic violence attitudes, and some of the media and information variables. We've also looked at, started creating these global health variables for household characteristics and household assets. Now, this is just a very new initiative that we're starting, and these slides have a very high level of the types of variables that we've started to create. I would highly recommend that you go and look at the user notes available for each of the projects for more information about how we've created these variables, where to find them for each of the projects, and what to do in terms of further data structuring and merging, including example codes. This user note is going to be dropped in the webinar chat. We will also be sharing these slides, and we will also reference this user note a few more times. So you would be able to get this URL in a few different ways after this webinar. Each of these new global health variables that we've created has all of the typical IPUMS metadata documentation, including codes pages, descriptions pages with references back to each of the 3 projects' original data so that you can look at more descriptions that are unique to each data collection, and a comparability section that refers to comparability issues among the interoperability variable. And we highly recommend that you still go to the original IPUMS DHS, IPUMS mix, or IPUMS PMA data variables in order to look at sample specific or country specific comparability within the projects. Finally, this webinar has been a very high-level overview of the interoperability across IPUMS Global Health projects, and I'm not going to spend a lot of time going into technical details about how to download or combine data extracts. At a very high level, for each data collection a researcher wants to include in their interoperable project, you would have to go and create a customized data file or an extract with the samples and variables of interest for each project, making sure that you're registered and logged in and have access to within each project. If the variables that you're interested in are among the global health variables that we've created, great. We've done the renaming and the recoding work for you, though we do recommend you look at the documentation on the website to make sure that you're fully aware and understand the decisions that we've made and the recoding that we've done. If you have other variables in your extract that you want to use in your analysis that do need to be renamed and recoded, you will have to do this prior to merging. Again, reviewing the websites and the documentation is a great place before conducting any analysis to get a full understanding of what is available. When you're ready to combine the data sets, there are additional data restructuring and appending steps that are going to be necessary depending on exactly which variables or which data files or which populations that you're working on. And we have documented some of the more common data restructuring and appending details in the user note, along with example code and some tips about how to do this. But this is very dependent on exactly which research question you are working on, and therefore there's a lot of possibilities in what you might want to do. Again, I'm not going to go through any of these coding details today, but encourage you to go look at the user note for more of the technical details. And I'm going to pass it back to Devin to return to the results from our example.
Excellent. Thank you so much, Anna. We're coming back to this research example we've been touching on throughout the webinar about the relationship between age, family planning use, and access to mobile phones. We compiled the data from all three project or data collections and create some graphs for you. This graph depicts family planning use among currently partnered and non-pregnant women aged 15 to 49 in selected sub-Saharan African countries. So as you can see, there is a general upward trend in family planning use over time, but there's quite a difference in the general level and the gaps between countries in these different contexts, with the highest levels of use being in Zimbabwe and Kenya, and the lowest levels of use over time in Niger and Nigeria. And you can also see that the time points are getting closer and closer together with more frequent data collection, and also the introduction of PMA and mix in later time points. So next, we will further break down this analysis by age group. So when we also looked at Kenya, so this is a mix of all 3 data collections, but it became a little too busy to identify the different data collections by data point here. But as you can see, this graph depicts family planning prevalence by age group in Kenya. And so even though the proportion of women using family planning varies a lot across countries, and we saw in the last slide, the age pattern of use generally is the same. So we see that usage is lowest among youngest women who may not have achieved their desired family size yet, peaking in the late 20s and 30s and declining after age 40. And of course, there are many reasons for this shape that have been investigated in the literature here, perhaps perceived declining risk of pregnancy due to lower fecundity or less frequent intercourse at later ages, and a lot of other factors. So notice that the prevalence of family planning use is generally increased among age groups over time within Kenya from 1989 to 2021. I tried to use a rainbow scale here to kind of depict the time trend here. And so next we're going to add in this stratification by household mobile phone use and versus not having access to a mobile phone. So this is again, family planning use by currently partnered or married women, but now, and by age group, but now stratified by mobile phone ownership at the household level. So you can see that the age pattern in Ethiopia is similar it's a similar shape between the two groups. However, for almost all levels, the group that has access to a mobile phone in a household is generally higher. So this is an interesting finding. If you would like to, please share your ideas in the chat about what you think mobile phone ownership might be a proxy for here, why we might be seeing this relationship. And then next, we produce this same graph for Kenya, but in this context, since answering the question of does this relationship change across context, you can see that there's a slightly different shape here between the mobile phone group and the no mobile phone group. Specifically, this kind of dip in the middle, like in 25 to 29 and 30 to 34 category among the no mobile phone use. So that's also an interesting finding that you might investigate a little bit more closely using these interoperable variables. So that's a very brief, a cursory overview of our results. We used pooling the different data collections using the appropriate weights all at national levels. So next is kind of summarizing this section of the webinar. So at IPUMS, we try to provide as many resources as we can to our research community in the form of instructional tutorials, recorded webinars like this one, and user notes like we've been mentioning throughout the webinar. We also have a user support email that is free to contact, and it's consistently monitored. We also host a user forum where you can post questions to other IPUMS data users for advice, and we also monitor that as well. We also post some Stata and R code to our GitHub if you would like to have some sample code for how we have done some analyses in the past. So with that, I will turn it back over to Anna.
Thanks, Devin. I'm just going to show a few more examples of the types of research that can be done when using data from multiple survey collections or data collections. This type of interoperability, as shown, is really great for summary indicators or national level statistics, as DHS mix and PAMA are often used to calculate and construct these types of indicators, such as those related to the Sustainable Development Goals. And so this type of national level indicator measures across time or within a region are a really good opportunity to be thinking about interoperability and merging data from multiple sources. Now, while it is possible to conduct analyses using the microdata and pooling for pooling data sets for statistical analysis, there are further considerations specifically regarding sample weights, differences in population sizes, both at the country level population, but also the sample size, and some of those underlying survey design differences. We don't have time to go into a lot of detail here today, and this is something that we urge researchers to really think carefully about on whether or not these considerations on weighting, population sizes, or survey design make it feasible or useful to merge data between projects for a particular analyses. We are at IPUMS Global Health continuing to explore these ideas, but this is very much dependent on the particular research question or the particular population that is being referenced within a research topic. So we do urge caution when thinking about statistical analyses at the microdata level. So here's a few examples of research that we've looked at. Similar to the family planning example, this graph shows household access to improved water sources, which is a Sustainable Development Goal indicator from some select sub-Saharan African countries. And by combining the long run of DHS surveys with some of the newer DHS mix and PMA surveys, you can really have a longer time trend by combining data from multiple data collections. This map shows coverage of country level indicators of family planning use, and it really represents the wide number of countries that are available in DHS mix and PMA. Now, while this particular variable on family planning method may not be recent for many of these countries, there are a lot of countries that are covered by one or multiple of the global health projects, and this can really strengthen regional or global analysis. This figure is from an analysis that our team conducted looking at intimate partner violence, and we were able to look to leverage the subnational geographic harmonization that the IPUMS geography team has done, looking at the subnational geographies in Zimbabwe and identifying that the subnational geographies for DHS and mix were identical. And so we were able to add the mix data from 2019 into this trend analysis at the subnational level. We really think that interoperability is an important tool going forward. And we at IPUMS Global Health are taking new steps towards this initiative. Currently, we're waiting to hear back about some funding, and we are hoping to continue to extend the number of global health variables that we've created, continue to publish crosswalks, particularly for the geography, but also for more of the indicators specifically related to the Sustainable Development Goals. And we are planning on creating further training materials, including new guides and webinars. These could include topics such as how to combine the data across survey types, looking at a more technical type of a guide or webinar, and including different types of example codes. And we're really open to other suggestions and ideas from users on what elements would be the most helpful. So if you have more questions, you can direct these to the ipums@umn.edu user support guide as we continue to shape this interoperable initiative in the face of the changing global health data landscape. So with that, thank you all for joining us. This is the user support email, ipums@umn.edu. Please do send any additional questions to ipums@umn.edu, and we will send out the slides, the recording, and that written document with the Q&A questions in the very, very near future. Thank you.